Sophie McAllister. I'm just going to introduce the rest of my CMC. I work with Alex Bell, Ian Maynor, Abdi Abdullahi, and Eleanor Kong, along with our CMC coach, Dr. James Frank. We worked in the San Francisco VA in the ICU on something called the ICU bundle in order to improve outcomes in the ICU. So the San Francisco VA's intensive care unit is a wonderful place. It's an important and life-saving part of the SFVA that cares for patients with severe and life-threatening illness. However, ICU stay can also be accompanied with complications, such as infections, including ventilator-associated pneumonia. Contributing factors to these complications include high levels of pain, prolonged mechanical ventilation, oversedation, delirium, and lack of early mobility. For example, over 80% of ICU patients will experience delirium at some point during their stay. These factors can also act synergistically when present together and can contribute and worsen each other. This can lead to poor outcomes, which can contribute to decreased quality of life and increased length of stay and mortality. To combat these ICU-associated complications, the Society of Critical Care Medicine created something called the ICU Bundle, which is a collection of evidence-based interventions meant to target these factors in the ICU associated with poor outcomes. The Palo Alto VA implemented the ICU Bundle and reported a significant decrease in outcomes like hospital death within 7 days, delirium, physical restraint use, and discharge to a facility other than home. We implemented 5 of these elements of the bundle, lettered A through E, to be checked daily by staff. Element A is to assess and manage pain daily. D is to perform both spontaneous breathing and awakening trials for intubated and sedated patients respectively. C is for appropriate choice of sedative. D is for delirium assessment, management, and prevention. And E is for an early mobility plan to be set for each patient daily.
We set the goals for our project in line with regional and national standards that call for 80% adherence to each of the bundle components. In order to evaluate the current state, we reviewed charts of over 200 patients staying in the VA ICU over around 10 weeks. And as you can see here, adherence for each of the bundle components was well below our target at baseline.
In order to reach these goals, we worked with our interprofessional team to identify barriers to implementing the bundle through weekly checkpoint with individual team members and monthly team meetings. Of the barriers we identified, contributing factors in people and communication were particularly important. Based on this gap analysis, we implemented predisposing, enabling, and reinforcing interventions. The predisposing interventions involved training and educating staff on the ICU bundle assessment, which was aided by the hiring of a new nurse educator. Our enabling intervention was a bundle checklist, which was integrated into the nurse workflow to ensure nurses recorded bundle data throughout the day. Our ICU bundle board, a whiteboard which publicly displayed whether goals for weekly bundle adherence had been met, was set up to motivate bundle implementation as a reinforcing intervention.
Okay. Next, we'll move on to the results. So this graph depicts the bundle board elements that involved all ICU patients. As was mentioned previously, the national target guidelines are 80% adherence to each respective bundle board element. So there is certainly some room for growth at the onset of our project. The region in gray represents our intervention period. And as you can see, for these bundle board elements, we're at the 80% target for all of them at the end of our project. This graph represents a subset of patients who were sedated and ventilated, which was a requirement to be assessed for the B and C components of the bundle. At the conclusion of our project, we were slightly below the 80% target for these components. You can also see that there was a bit more variance month to month for these bundle board components, and we attributed that largely to the more complex nature of addressing these bundle board components, as well as the smaller sample size. Still, there was overall a significant improvement from the baseline conditions. So we're very excited about the results of our project because the full implementation of the ICU bundle is an evidence-based approach to improving patient outcomes in the ICU, such as by decreasing rates of delirium and improving overall rates of mortality.
So these are the things that we think are some of the factors that contributed to our success. First, we fostered buy-in from the ICU and from the medical center leadership, and this getting leadership support was critical to our project because they had access to resources that were essential to our project, such as the nurse educator. We also made sure we had consistent communication with the ICU team to facilitate troubleshooting, integration of any of their suggestions into our intervention, and to foster a sense of team between us and the ICU. We also made sure to focus on shared goals to improve patient care rather than focusing on individual performance, and this is crucial in getting support from the ICU team and getting them really enthusiastic about the project. We also identified interprofessional champions who helped lead the project when we weren't there, and this helped move the project forward, but also cultivated a sense of ownership within the ICU, which were really important contributors towards fostering enthusiasm and sustainability of the project. And we also made sure that our intervention focused on consolidating workflows and integrating them into the daily routine, just to help limit any additional work that might be placed on the staff that would limit adoption of the project, while also speeding up their daily routine. So to this day, 3 months after the project ended, the ICU staff is still completing the checklist and the bundle board, which is really exciting for us to see. And finally, we'd like to thank everyone who helped us on our project. We definitely couldn't have done all this work without them. And thank you for listening, and feel free to ask any questions.